Welcome back to the Nurses Study Partner. This is Diarrhea, Part 2 Pathogens, Complications, and Chronic Causes in 10 in depth scenarios. We'll cover cholera, dysentery, C. difficile, and giardia, the electrolyte and acid base problems, when to avoid anti motility drugs, traveler's diarrhea, celiac disease, and the WHO rehydration plans. Read each case, weigh all four options, pause to choose, then check your reasoning. Let's begin. Question 1. During a cholera outbreak, an adult presents with sudden, profuse, painless, watery diarrhea that looks pale and cloudy with flecks of mucus, like water left after washing rice. He has vomited and is rapidly becoming severely dehydrated with no fever. Which organism and priority does this suggest? Option A, rotavirus. Simply reassure and send him home. Option B, a food allergy. Give an antihistamine tablet. Option C, norovirus. No fluids are needed in this case. Option D, Vibrio cholerae. Rapid aggressive rehydration. Pause here and choose your answer. The answer is D, Vibrio cholera. Rapid aggressive rehydration. Profuse, painless rice water stools with rapid severe dehydration and no fever during an outbreak are classic cholera. The priority is rapid aggressive rehydration, IV Ringer's lactate for severe cases, then ORS because massive fluid loss can kill within hours. Antibiotics like doxycycline or azithromycin shorten the illness but do not replace fluids. It is not rotavirus, allergy, or norovirus. Question 2. A patient has crampy abdominal pain, fever, and frequent small stools containing visible blood and mucus, with a painful, ineffective urge to keep passing stool. Stool testing suggests Shigella. Which describes this correctly? Option A, dysentery, needs antibiotics and no antimotility drug. Option B, simple watery diarrhea, treat with loperamide now. Option C, a harmless finding requiring no treatment at all. Option D, osmotic diarrhea that will stop as soon as he fasts. Pause here and choose your answer. The answer is A, dysentery. It needs antibiotics and no antimotility drug. Bloody mucoid stools with fever and tenesmus is dysentery, and inflammatory diarrhea, here from Shigella. Unlike simple watery diarrhea, dysentery is treated with antibiotics, guided by local patterns alongside rehydration. Antimotility drugs like loperamide are avoided in bloody diarrhea because they can worsen it and risk complications. It is neither harmless nor osmotic. Question 3. An older inpatient on broad-spectrum antibiotics for a week develops frequent foul-smelling watery diarrhea with lower abdominal pain, and stool testing confirms Clostridioides difficile. Which management is most appropriate? Option A, continue the antibiotic and add a strong antimotility. Option B, clean hands with alcohol gel only, no isolation. Option C, stop the offending antibiotic, oral vancomycin, isolate. Option D, ignore it as antibiotic diarrhea is always harmless. Pause here and choose your answer. The answer is C. Stop the offending antibiotic, give oral vancomycin, and isolate. C. difficile follows broad-spectrum antibiotics that disturb the gut flora. So we stop the offending antibiotic where possible, give oral vancomycin or fidaxomicin, metronidazole is no longer first line, and apply contact precautions. Crucially, hands must be washed with soap and water because alcohol gel does not kill the spores, and antimotility drugs are avoided due to the risk of toxic megacolon. It is not harmless. Question 4. A young man returns from a hiking trip where he drank from a mountain stream. He now has 2 weeks of foul-smelling, greasy stools that float with bloating, wind, and cramps, but no blood and no high fever. Which infection and treatment fits best? Option A, cholera. He needs only intravenous fluids urgently. Option B, giardiasis. Treat with metronidazole. Option C, Shigella dysentery. Give an anti-motility drug. Option D, a normal gut needing no treatment or follow-up. Pause here and choose your answer. The answer is B, giardiasis. Treat with metronidazole. Persistent, foul, greasy floating stools with bloating and wind after drinking untreated water is classic giardiasis. The fat malabsorption makes the stools greasy and floating. Treatment is metronidazole or tinidazole. It is not cholera, which is acute and watery, not Shigella dysentery, which is bloody with fever, and it does need treating. Question 5. A patient with several days of profuse diarrhea complains of marked muscle weakness and cramps. His ECG shows flattened T waves and prominent U waves, and his serum potassium is low. Which electrolyte problem is this, and what is needed? Option A, high sodium, restrict all fluids immediately. Option B, high calcium, give large doses of vitamin D. Option C, high potassium, give insulin and glucose now. Option D, low potassium, replace potassium carefully. Pause here and choose your answer. The answer is D, low potassium, replace potassium carefully. Diarrhea causes loss of potassium in the stool, leading to hypokalemia, with muscle weakness, cramps, and the classic ECG changes of flattened T waves and U waves, plus a risk of arrhythmia. Management is careful potassium replacement, oral or IV, with monitoring alongside rehydration. This is low, not high potassium, and it is not a sodium or calcium problem. Question 6. A patient with severe prolonged watery diarrhea has blood gases showing a low bicarbonate and a low pH with a normal anion gap, and he is breathing deeply and rapidly. Which acid-base disturbance has developed and why? Option A, respiratory alkalosis from breathing too fast. Option B, metabolic alkalosis from losing stomach acid. Option C, metabolic acidosis from losing bicarbonate in stool. Option D, a completely normal set of blood gas results. Pause here and choose your answer. The answer is C, metabolic acidosis from losing bicarbonate in the stool. Intestinal fluid is rich in bicarbonate, so severe diarrhea loses it, giving a normal anion gap metabolic acidosis with a low bicarbonate and low pH. The deep, rapid Kussmaul breathing is respiratory compensation, blowing off carbon dioxide. Management is rehydration, which itself helps correct it, and treating the cause. It is not alkalosis, respiratory, or normal. Question 7. A patient with bloody diarrhea and fever asks for loperamide to stop it quickly, as a friend gave him some tablets that helped with the previous watery upset. Which is the most appropriate response? Option A, avoid loperamide here. Bloody diarrhea is different. Option B, give a double dose to settle it as fast as possible. Option C, it is completely safe in every kind of diarrhea. Option D, only give it together with a strong antibiotic dose. Pause here and choose your answer. The answer is A. Avoid loperamide here because bloody diarrhea is different. Antimotility drugs should be avoided in bloody, inflammatory, or febrile diarrhea, in dysentery, and in C. difficile because slowing the gut can trap toxins and organisms, prolong the illness, and risk toxic megacolon. They are also not used in young children. They may help only in mild, non-bloody, afebrile diarrhea in adults. So this patient should not take it. Question 8. A traveler planning a trip to a region with poor sanitation asks how to avoid the watery diarrhea that often affects visitors and what usually causes it. Which advice and cause are correct? Option A, it is untreatable. There is nothing at all he can do. Option B, often ETEC. Use safe food and water precautions. Option C, it is caused only by cold weather, not by any germ. Option D, he should drink untreated local tap water freely. Pause here and choose your answer. The answer is B. It is often ETEC, and he should use safe food and water precautions. Traveler's diarrhea is most often caused by enterotoxigenic E. coli from contaminated food and water. Prevention is safe food and water. Boil it, cook it, peel it, or forget it, plus bottled or treated water, avoiding ice and raw foods, and hand hygiene. Most cases are self-limiting and treated with fluids, with antibiotics reserved for severe or dysenteric illness. It is neither untreatable, weather-caused, nor a reason to drink untreated water. Question 9. A 30-year-old has months of loose, pale, greasy stools with weight loss and tiredness. Blood tests show anemia, and her symptoms clearly improve when she stops eating wheat and other gluten-containing foods. Which diagnosis is most likely, and what is the treatment? Option A, celiac disease, a lifelong gluten-free diet. Option B, acute viral gastroenteritis, just wait a few days. Option C, simple cholera, give her antibiotics right away. Option D, a normal gut needing no dietary change at all. Pause here and choose your answer. The answer is A, celiac disease, a lifelong gluten-free diet. Chronic greasy stools, weight loss, tiredness, and anemia that improve off gluten point to celiac disease, an immune reaction to gluten that damages the small bowel villi and causes malabsorption. Treatment is a strict lifelong gluten-free diet, with the diagnosis ideally confirmed before starting it, using serology and biopsy. This is chronic, not acute gastroenteritis or cholera, and it clearly needs dietary change. Question 10. A nurse is learning how the WHO structures rehydration for children with diarrhea, matching treatment to how dehydrated the child is. Which correctly matches the WHO plans to dehydration level? Option A. All children always need intravenous fluids first. Option B. No child ever needs more than plain drinking water. Option C. A. None. B. Some. C. Severe dehydration. Option D. The plans are chosen purely by the child's age. Pause here and choose your answer. The answer is C. Plan A for no dehydration, Plan B for some, and Plan C for severe. The WHO plans match rehydration to severity. Plan A, no dehydration, means extra fluids and ORS at home after each stool, plus zinc and continued feeding. Plan B, some dehydration, means supervised ORS over about 4 hours in a facility. And Plan C, severe dehydration, means urgent IV fluids. So, treatment follows the assessment, not age, and not everyone needs IV or only plain water. Let's recap diarrhea part 2. Cholera gives rice water stools and needs rapid rehydration. Dysentery from Shigella is bloody and needs antibiotics, not antimotility drugs. C. difficile follows antibiotics. Stop the offending drug, give oral vancomycin, isolate, and wash hands with soap and water because gel won't kill spores. Giardia gives greasy floating stools and is treated with metronidazole. Diarrhea can cause hypokalemia with weakness and flat T and U waves, and a normal anion gap metabolic acidosis from bicarbonate loss. Avoid antimotility drugs in bloody or inflammatory diarrhea. Traveler's diarrhea is usually ETEC, use safe food and water. Celiac disease gives greasy stools and anemia and needs a gluten-free diet. And the WHO plans match rehydration to severity, A for none, B for some, C for severe. Keep going and remember, we don't pass alone, we pass together.